Now, a Ugandan woman has been dubbed the most fertile. The 39-year-old is a mother to 44 children, although 6 have died, and they're all from the same man. Now, with my next guest, we ask, can super-fertility be described as a medical condition? So I'm joined by gynecologist Dr Lusanda Shimange-Matsose to give us insights on that. Dr Lusanda, thanks a lot for joining us on Newsnight.
Thanks for having me.
Is there such a thing as super-fertility?
So there is, but we're more inclined to call it hyper-ovulation.
Okay.
So that's just a woman who releases more than one egg during a single menstrual cycle.
Okay.
So a normal woman who will have one pregnancy, should they fall pregnant, will have just one egg. A woman who's hyper-ovulating will have one more, and those eggs get fertilized, and therefore results in multiple pregnancies.
Okay, but then how do you know that indeed I'm the woman that produces multiple eggs instead of just one egg?
So, I mean, you have to look at, there's a few things that have been described. So there's a genetic component to it. So if along your mother's family, if people have been having multiple births, so that puts you at risk of having. We look at age as a factor. The older you are, the more inclined you are to have.
I don't like this conversation.
The more inclined you are to have multiple births.
Yeah.
And then obviously you have to look at diet and then the demographics. So we know that women in Central and West Africa are more inclined to have multiples versus women in Latin America and in Asia. Look, genetics, back to genetics, diet as well. And yeah, I suppose.
What about South Africa? I mean, how are South Africans faring in terms of fertility? South African women in particular faring, in terms of fertility in comparison to the rest of the African continent? Because this woman was from Uganda, and this just makes me think, is it because we're eating at certain takeout joints that are actually hampering our ability to be more fertile as women in South Africa?
Well, we know that diet does have an impact on your fertility at the end of the day. That's why, I mean, you'll get a lot of patients asking, what should I do to increase my chances of falling pregnant? And you know that...
And that is a question I'm going to ask you before I release you, by the way. What do I do to ensure that I can fall
Stop
pregnant?
smoking, stop doing drugs, stop drinking alcohol, drink your green veggies, don't eat red meat. I mean, there's a long list that I can...
Don't eat red meat, you've ruined everything.
There's a long list I can give you, but we know that, I mean, with women who are more in those remote areas, they have more of an organic diet versus women in urban areas, right? And in terms of South Africa, with regards to the rest of the continent, a lot of women, in fact, maybe not say South Africa, just in the whole world, a lot of women are putting off fertility because of career aspirations and so forth. But with that being said, then there are... there's an increased risk of fertility treatment, which is also one of the risk factors for having multiple births.
So how old should I be if I want to have children the natural way, and if my body will be able to be fertile enough to carry children full term and even have 1 or 2 or 3 or more at my choosing? What is the age that I'm supposed to be to have children?
So we speak about women of reproductive age, and that's basically any woman who's had her first menstruation and now is having her menstruation every month, right? So you're basically ready to have a baby. But with each menstrual cycle that you have, that decreases your chances of actually falling pregnant. So I could say you can be 25 or you can be 42. Either way, you're of reproductive age. It just depends on you personally, what your body will present. So will you have fertility problems or not? You don't know up until you start trying.
So no woman knows whether or not they are fertile up until they start trying for a baby?
Look, every woman thinks they're fertile up until they start trying for a baby, and then they're not falling pregnant, and then they come to us and then tell us, look, I've been trying to fall pregnant for so long and nothing has happened. And then we start the investigations, and then we discover, okay, this is why you're not falling pregnant. Yeah.
And then on the other side of it are women who are super fertile now. The women that are super fertile, do they fall pregnant even though they're on any form of contraceptive?
Well, you have to look at the different types of contraceptives that you get, right? And we speak, and each one has its, what do you call it? There has a success rate, if I can put it that way. So, e.g., if you abstain from having any sexual contact, you won't fall pregnant, right? Do you know what I mean? Versus natural methods, where you use calendar methods and so forth, where you've got an increased risk of falling pregnant. So it's not to say just because you hyper-ovulate or you're super fertile that you'll fall pregnant if you're using contraception. It depends on how you're using contraception. Is this the best contraception for you? Are you using it according to what what has been prescribed? Or are you like forgetting your pill today and then 3 days later, oh my gosh, I've got to take a pill and then take the next one? Do you understand? So obviously that increases your chances. So those women, if they are on contraception, ideally they should not fall pregnant provided they take their contraception the way it's prescribed. Perfect use of any form of contraception.
So then would you say that on the inverse of it, that women that do not necessarily go on any contraception or have had any contraception, because, I mean, you've got even 13-year-olds that are on contraception for skin issues, right?
Yes.
A lot of the times they get prescribed for their skin, etc. Yeah. So they start contraception at a very young age, not necessarily because they're sexually active, just simply because of skin requirements or their hormonal adjustments, right? So women that have never been on any form of contraception, would you say that then they are more likely to be fertile because of the hormonal adjustment, or does contraception, what I'm basically asking is, does contraception actually impact or an effect on the way in which you're on your fertility?
So it depends on the type of contraception that you take. So e.g. the injectables, we know that there's a longer time to return to fertility when you've been on injectables versus if you're taking the pills. But with that being said, if you've never been on any contraception, it does not mean that you are any more fertile than the woman next to you who's been on contraception. It's really just individual, on an individual basis.
Okay, and then when it comes to issues around super-fertility, how does a woman who feels or is at home right now and has been wanting to fall pregnant and has been struggling with pregnancy, how do you help her then get to the stage of being fertile and being able to carry a child? In other words, what can she do at this moment in time, besides going to the doctor and gynecologist? I know your answer is going to go there. Besides going to the gynecologist, how do women capacitate themselves so that indeed they're able to be more fertile, or to, you know, get their bodies in a form where they are more fertile?
So first of all, in order to fall pregnant, you need to ovulate, right? And when do you ovulate? When you're having your menstrual cycle every month. And for that woman out there, she must know that you don't have 30 days to fall pregnant. You've got a small window to actually fall pregnant. So for me, I would say keep track of your menstrual cycle, know how many days you have your period for, and then after how many days again do you have your period. That way you'll be able to work out your cycle. By working out your cycle, you'll be able to work out when you ovulate. And when you're ovulating, that is your most fertile period.
And how long is that ovulation period? Because this is where women fall pregnant. Some women fall pregnant and they go, oops, what happened? And other women fall pregnant and they say, how many is it?
So it does vary, but like 2 to 3 days maximum.
So some women have got 2 to 3 days.
Yes.
They want to have a child to fall pregnant.
That's why you'll have a woman who will be like, no, I've been trying to fall pregnant forever, but nothing happens. And then her husband or her partner does not stay with her, he does not visit, and then we get together once every month and you expect to fall pregnant. But then at that time, when he comes and visits, it's actually not around the period that you are ovulating, so nothing is going to happen.
Sure.
Yeah.
It's a whole lot of, adjustments that women have to make. Talk to us about the diet side of it.
I mean, look, with anything in medicine, we always speak about a healthy diet. Do you know what I mean? It's not to say if you smoke and you drink and so forth, you won't fall pregnant. No, you will. But if you want to increase your chances, there's nothing wrong with a healthy lifestyle altogether, because even when you do fall pregnant, right, then it's an easy adjustment when you're pregnant. Healthy mom, healthy baby. That's basically it.
I'm going to be on the subject of super-fertility. When he was looking at the woman, or the case of the Ugandan woman in itself, she had lost 8 children. So whether or not you are super fertile, what if there's a woman that is super fertile and is able to fall pregnant, but she has multiple miscarriages. So she goes through the process of falling pregnant. Yes, the egg catches, but she's not able to carry children to term. And she goes through this 4 or 5 times or 6 times, because number one, that's quite disheartening. But number 2, does that mean she's fertile, or does that mean she's infertile?
So that is the problem with super-fertility. So if you keep falling pregnant, most of the time those embryos that are getting they're getting implanted in your womb are actually not normal embryos, right? So hence that will probably lead to miscarriages. So is she fertile or infertile? No, she is fertile, but she's just got poor obstetric history. So that person would also need to be investigated. So in other words, in the event that when she miscarries, is to actually take that conceptus and then take it for genetic testing to see actually what is wrong. There is options like that. But that woman is fertile. As long as you can fall pregnant, you are fertile. What we really want to focus on is the take-home baby rate. So anyone can fall pregnant, but are you going to take a baby home? In other words, carry to term or carry to viability. In other words, where the baby is can survive outside the mom's body.
Sure.
Yeah.
So much to learn about the human anatomy. I'm telling you now. Dr. Thanks a lot for joining us.
Thank you very much for having me.
Some light in terms of fertility. There you have it, ladies. If you want to know if you're fertile, infertile, super fertile, some advice for you on this Sunday evening on Newsnight. Well, stay